So my general reaction to the authors is that I definitely agree with them. Um, it's kind of coincidental that this was our reading this week because actually one of the psychologists at my practicum agency told one of my classmates that it doesn't matter what type of therapeutic approach you use, and that the therapeutic relationship and rapport is what matters the most. So it's kind of interesting that we're learning about this, and that's actually happening at my practicum agency. We also have been talking a lot about how clients will use alternative approaches. Like we're going to go to the mystical market and listen to some talks about like crystals and anxiety and stuff like that. Um, so yeah, I definitely agree that there is a problem with clinicians using um, practices that are not evidence based. As we learned in the article, they can be very harmful. I think it's interesting that they kind of use some of the most extreme examples, like the rebirthing thing. But I'm sure there's better, or not better, but more examples of this, that aren't as extreme. But we need to make sure that we're not doing harm to people, especially with psychotherapy and with vulnerable populations. So I do agree with them. Um, for the second question, so yeah, I don't think that the profession of social work is overly enamored with evidence-based practice. I think it's really important. Um, I think if you do try something, I don't know, off the wall, or just something does end up happening in the conversation that isn't evidence based, no, it's not the worst thing in the world. But, to justify continuing that type of treatment, you would need to find out if there is research supporting it and what the outcomes are associated with it. So, yeah, that's it.